Hello and welcome to my YouTube channel. Today I'll be speaking to you about a condition that you can do something about, ensuring that you don't contract this infection. It's called typhoid fever. It's caused by an organism or bacteria called Salmonella, and is a condition, an infection that is spread through eating unclean food or water, eating food that has not been cooked thoroughly or washed with clean water. People living in poor sanitary conditions are vulnerable. And also for patients that take antacids, proton pump inhibitors, basically to suppress the acid in the stomach. When we do that, what that means is that we create an enabling environment for this organism to thrive, because the lower the acidity in your stomach, the greater the chances for this organism to grow. What are the symptoms of this condition? Number one, fever. Also headache, cough, nausea, vomiting, constipation, diarrhea, abdominal pain, skin rash. This condition can be treated by use of antibiotics. However, complications can occur in patients that are either untreated or poorly treated. For example, some patients may become carriers. What does that mean? They are asymptomatic. In other words, they have no symptoms, but the problem is that they can transmit the disease. So such people, although are asymptomatic, when they go to the toilet, they can shed bacteria in their stool. And so it means that you've got to be very mindful about where you go to eat, particularly, say, restaurant, where if you have an asymptomatic person there that is not given to good personal hygiene, passes through and doesn't wash the hands properly, prepares food that you eat, you can become predisposed to developing this infection. The organism can sometimes infect Peyer's patches, which are specialized immune tissues on the wall of the gut. If that occurs, these can ulcerate, the gut can ulcerate, and eventually perforate. When that happens, it predisposes to an infection of the lining of the tummy called peritonitis. So if you have an infection of the peritoneal membrane, that's peritonitis. So number one, patients can be asymptomatic carriers. Number two, there could be bowel or gut perforation, as intestinal perforation. Number three, there can be development of peritonitis, which is an infection of the lining of the tummy called the peritoneal membrane. How is diagnosis made? It's primarily clinical. In other words, based on the symptoms the patient is presenting with, we can make a diagnosis of typhoid fever. However, if tests are going to be done, the very important test that needs to be done will be a culture, which means isolating the organism, either doing a blood culture or a stool culture. For a long time, we've used a test called Vidal's test or Vidal's reaction, depending on where you're pronouncing from, to make a diagnosis of typhoid fever. The problem with this test is that it is neither specific nor sensitive. And so the Vidal's reaction or the Vidal's test is not a reliable test for making a diagnosis of typhoid fever. The treatment for this condition will be based on use of antibiotics. I need to mention that some antibiotics, there's some resistance, and so it's important to speak with a doctor to prescribe the medication. But in terms of speaking broadly, antibiotics that could be used could be carbapenems, fluoroquinolones. But like I said earlier on, speak with a doctor to guide you. So what can you do? What steps can you take to preventing this infection? Number one, you could get vaccinated. Number two, whenever you use the toilet, wash your hands with soap and water. That sounds very elementary, but it can prevent an infection. Soap and water. If there's no soap and water, which I mean could happen, use the hand sanitizer. And then ensure that food is properly cooked, properly prepared. Use clean water when you're washing. And very importantly, when you cook and the food becomes cold, rewarm thoroughly before eating. And so typhoid fever is a condition where you can do something about preventing. Good hygiene, good personal hygiene, and also being mindful of what goes through your mouth. If you've learned something, like, share, subscribe.